All right. Well, good afternoon, everyone. I'm Bob Ravenscroft, the Vice President for Advancement, here for today's briefing. We haven't had one in a while. First of all, I would just like to thank members of the media for your honest and truthful coverage of this pandemic from a healthcare perspective and how you're covering every element of how it impacts our communities. It makes a difference, and we're grateful. I know the vaccination rates in Lancaster County are outstanding compared to the rest of the state. Same thing in Douglas and Sarpy. And I think that means there's an informed citizenry, and it's really preventing a harrowing situation like we're seeing in some border states, at least so far. We do wish we weren't conducting this press briefing today, but here we are. There's still a little bit of work to do. Before we really get going, there was a big CDC announcement yesterday. And I know we've had some questions or inquiries about it. Well, kind of here's our position on it. In healthcare and at Bryan, we have been adhering to CDC standards long before the pandemic. We are today, and we will be into the future. They continue to be a reliable and trusted source for our physicians and our team to make decisions. And additionally, there are accreditation requirements that tie back to that. So that's all we really have to say on the CDC statement is it's something that we're complying with past, present, and future. With us today are John Woodrich, the president of Bryan Medical Center and the executive vice president of Bryan Health, and Dr. John Trapp, who is our chief medical officer and also a pulmonologist here in Lincoln. Collectively, we're going to share a little bit how lives are being impacted here in Lincoln currently and what is really becoming unavoidable sorrow and heartache that is being faced by our comfort care teams again, our respiratory therapists, our nurses, our physicians, almost every element of the organization. They're some of the smartest, toughest, most dedicated people that I know. I think they'll rise to the occasion, but there's an element of frustration and even a little sadness because this is largely preventable, and we also know what might lie ahead. What's making it a little bit different now is the generations that are being impacted by it. We have nurses that are new grads all the way up to like my age, and we are now seeing patients that are younger than many of us or the same age of our youngest or middle-aged folks, even like myself. Again, it's a free vaccine, widely available. This is largely unavoidable. So we'll get right into it. We strongly urge you from a Bryan Health perspective in the most serious way for all of our fellow Nebraskans to get vaccinated. And this is really not a say what or do what we say, not what we do thing. So Jeff, if you could pull up the first slide. Right now, 84% of our employees are vaccinated, and you can see 95% of our employed physicians, physician assistants, and APRNs are vaccinated. A little bit more about our employee vaccination. Back in early March, after we got through our 2-dose routine of both Pfizer and Moderna, we were at about 74%. And through continuing education, answering employees' questions, it continues to inch up. From a medical staff perspective, within days of the vaccine becoming available, what we could record at Bryan from our medical staff, 74% within days of it becoming available. And we know that's higher because some members of our medical staff also got vaccinated over at CHI St. Elizabeth's. So right here, I think it speaks for ourselves of what our employees and our physicians think about the efficacy of the vaccination. The reason we're sharing this is we do field questions, and there's a lot of misinformation out there alluding to we know a doctor or we know a nurse that works at Bryan and there's no COVID and they aren't even getting vaccinated. This is what is happening here at our organization, and we have a goal to increase that percentage on both of these categories even more over time. This is a widely available vaccine, and I encourage you to continue sharing this with our population. You can get it via text, you can get it via email, you can go to a website. It is free and accessible. So this is always the uncomfortable part of this for me, to go through the daily statistics, because they aren't really statistics to us. There's a life behind all of these numbers, and there's an army of dedicated people trying to treat, cure, comfort, and get them back to their families. But we'll get right into it before I bring John up to this podium. As you can see, we currently have 25 COVID positive patients in Bryan Medical Center, getting to be about 50-50 from Lancaster County residents and residents from outside of Lancaster County, mostly rural counties around Lancaster. I believe there's one even from northern Kansas here. There are an additional 7 patients that are still in dire need of critical care, but have been here long enough that they are no longer infectious. So we have, as of this morning, 32 of our beds occupied by COVID patients. For severity, Dr. Trapp can cover a little bit more of this, but you can see 5 of these patients are still on ventilators. And from following this, like you guys all have, you know what that means for patients. We wanted to share this also this is where it's really changing for our team, and I think a lot of anxiety and frustration is coming in because they're seeing a much different population than we did when none of the population was vaccinated. The patients are skewing younger. The numbers speak for themselves. They're almost half of them are under the age of retirement that are now occupying beds here at Bryan Medical Center. To further this more, for all of our inpatients that are unvaccinated or that are under the age of 50, 100% of them are unvaccinated. For those over the age of 50, 91% are unvaccinated. There are some breakthrough cases. Dr. Trapp will talk a little bit about what happens there. And of those that are unvaccinated, one of them only completed their first dose of a vaccine. Now, if you're trying to sync up the numbers from where we are today and the percentages I just shared, the age breakdown is something we only do once a week, so that was as of weekend numbers. That's what those percentages were driven from. The last slide I want to show you, and I think it really highlights the challenge that we're facing right now. The gray bars there are our daily inpatient censuses of the non-COVID patients that we still have to deliver care to. The blue line graph down at the bottom are our COVID inpatients. I think what is interesting and a little, unsettling is if you look at those first 2 text boxes kind of to the left of the screen, you can see where we were on the blue line, and that's when LPS and UNL and Wesleyan and Union students all came back to town last year. Again, we were not vaccinated as a community at that point. We all know what happened through the November and December months. You can see in further text box when we kind of were all alarm fire and produced some PSAs distributed through the state, and you saw communities implement mask mandates. It drove down. You see what happened when vaccinations occurred, and it got down to virtually 0. And now, certainly with the variant and the unvaccinated population, we are at a higher case rate now than we were when school was starting last year. So that kind of sets the stage. I'm going to turn it over to John Woodrich, again, president of Bryan Medical Center and Chief Executive Vice President of Bryan Health. So John, and then following John, Dr. Trapp will come up, and then we'll field questions from the media after that.
Thank you, Bob. And I just want to reiterate what Bob covered in relationship to the numbers of individuals here in-house and the way it's impacting our staff. But before I get to that, I really want to go back and thank our health department, all the other health systems in this community that all work together to make this vaccine available to everyone. And I think we've made a significant impact, but we've got a lot more work to do. This plea is to ask other people, please get your vaccine. You've heard from these statistics about this younger generation now that we're seeing in the hospital. These people are critically ill. They have not received the vaccine. We know this vaccine makes a huge difference. So our plea to you is if you haven't received this vaccine, please go get it. You know, we had to open up a COVID unit again the other day. We hadn't done that in a while. We actually got down to 0 COVID patients in this facility about 3 or 4 weeks ago. And you see this rise. We're watching what's happening in other communities where this outbreak occurs. And quite honestly, we're ready for this, but we shouldn't be in this situation. People need to take accountability and get this vaccination. You know, we had to make some real tough decisions about allowing visitors in-house and, you know, when people are, how many loved ones we can let in. And now we've opened it back up again, But if we continue at this rate, we're going to have to revert back to what we did in the past, and that's very difficult to do. Our staff, as Bob mentioned, you talk about heroes. They have gone above and beyond. Our medical staff, this community in general. We can't watch this happen again. There's a large number of people that we need to continue to take care of just general medical needs. And now having these added pressures of we're watching our number of COVID patients get into the mid-20s and then others that are recovering, 30-some beds occupied with COVID patients. And as we mentioned before, we're probably even more prepared than we were in the past because we learned a lot. We've gone through a lot of exercises of keeping notes and what could we have done better and how could we have done things differently. But quite honestly, this is avoidable. So my last plea to people, please go out there and get your vaccine. It is available to you. It makes a difference. We are following the science, and we've proved this is a game changer. I think so many people have been waiting for it. It is now available to you. So many people in this community have worked together to go ahead and make this accessible to you. What our health department has completed, and what our other healthcare facilities working together to say, how are we taking care of this? This is our job. This is what we live for every day. So we're asking you and pleading with you one more time, please get your vaccine. With that, I'm going to turn this over to Dr. Trapp.
So thank you, John and Bob. And as Bob went through some of the numbers at Bryan Medical Center, we certainly are seeing higher numbers, 30 plus. This has been a significant increase over the past 4 weeks or so. And, this is a frustrating issue. It's frustrating for staff, it's frustrating for patients, and this is our third wave of the pandemic, and some may even look at it as our fourth wave. And it's hard to know how high this peak will be. This creates a lot of stress on the staff, creates stress on families, patients, of course. And again, as has been said, this is something that's potentially preventable. So vaccination is a way out of this. We know to reach that herd immunity, if you will. There's only really one way to get there. It's either get the vaccine or get the infection. We know that getting the vaccine is far safer than taking your chances with the infection. Many of the patients, if not all the patients in the hospital today, did not expect to get this severe of an illness. So again, for those who have a loved one in the hospital, right now, there is no visitation allowed for our positive COVID patients. So I do want to iterate that. This is tough on our staff to have to turn you away to say that visitation is not allowed. For those patients hospitalized, we are back to the nurses and staff utilizing utilizing iPhones or tablets to communicate with their loved ones at home. And this is really difficult to have these tough communications with patients that may or may not leave the hospital alive, not knowing what the next step is in their life will be. And we are seeing a younger population, a population with family who are young children potentially. And again, very tough on families, very tough on staff to have those hard conversations. So again, we're going to encourage people to get vaccinated. If you've been on the sidelines or on the fence with regard to vaccines, please get your vaccine. We know it's important. It's a way to get through this pandemic. Kids, urge your parents to get vaccinated. Tell them you want them to be around to see you grow up. We know it's the younger population that is the lowest vaccination rate right now. With that, I'm happy to answer questions with regard to pandemic or other topics that you may have for us.
All right, we'll wait a second to see if questions come in. Until we do, I know that one thing we've been seeing through social media and when people reach out to us, Dr. Trapp, is what are the differences with this Delta variant versus what you saw, in 2020 when it was the original variant?
Sure, I think that's been fairly well described in the media and in the literature. The Delta variant is the primary variant that we're seeing in Nebraska today. It's also the primary variant that we are seeing infecting many of our younger population. We believe it to be much more highly infectious. I've seen estimates of 10 times more infectious than the original variant of COVID. Some will say it may increase the severity of illness. I don't know that that's perfectly clear. We are seeing many of the same symptoms. It may present with fever, cough, malaise, shortness of breath, and in those who are hospitalized, low oxygen levels of viral pneumonia, if you will, with other aspects of viral syndromes. Again, this virus can infect not only the lungs, but the heart, the brain, really a systemic type illness. So again, more highly infectious, potentially associated with more severe disease, certainly seeing that primarily in our unvaccinated population. We do have some patients that have been vaccinated, Bob brought that up, who are in the hospital. Those typically are our older patients who may have some coexisting health conditions, may be on medications that limit the response of their immune system to their original vaccination or allow the virus entry into the body. So those are primarily who we're seeing hospitalized who have been vaccinated. Again, tend to have less severe illness. And again, reiterating what's been said on the national level, the patients that are dying in the hospital, 99% of those are unvaccinated patients. Thank you.
Stay close. We have a question. Do you ask patients why they didn't get vaccinated? And if so, what are some of the responses? I'll share something and then I'll ask Dr. Trapp to come up and speak to that from a physician's perspective. I'm going to talk specifically about our employees. After that first wave of vaccination, when we got to about 75%, we did survey our employees and had a tremendous response. And the prominent reasons at that point were childbearing age, recommendation from a physician because some other illness they had, and awaiting FDA approval. There were some other kind of straggling issues. But I do believe that's why our employees have gone from that kind of 74, 75% up to close to 85%, because we have connected them with their physicians and answered the questions about being in childbearing years. They have learned more from the plethora of information out there, and it just increased the comfort level for some people. But those were the prominent reasons of why our, that small part of our employees initially didn't initially get the vaccine. As for the patients, I know that there has been some discussion just actually on today's pandemic call of how can we offer it to patients while they're in here. And there was some discussion about certainly physicians talking to patients about that. So again, I'm giving this to you to answer that.
Thank you, Bob. So a lot of reasons why they may not have gotten the vaccine. Some of it's the unknown. Some were concerned about safety of the vaccine. Some really felt like I didn't need the vaccine. I'm otherwise young and healthy. This doesn't impact me. I didn't think I would get infected. I've been careful. I've avoided situations. Some just disbelief that this is a real problem for a variety of reasons. And most of this has been due to really just a lack of a consistent message that we need to get out to our public, that this is a safe vaccine, that this is medically recommended for essentially all patients. There's very few exceptions to this, and it's widely available. We were asking for this vaccine back late last year, many of us begging for this vaccine. It's now here. Those who have wanted the vaccine have been able to readily get it, but we have a lot of people still on the sidelines. So you think in your own mind why you have not yet been vaccinated, and think about yourself and think about the risks of the vaccine, which we believe are very, very low compared to the risk of an actual infection with this virus, which many will get over without major events. But unfortunately, are you willing to take that chance that you won't be one of the majority, but you'll be one of the patients who are most at risk and be hospitalized with that potential risk of not going home again?
Matt, I know that you and every member of the media that all have social platforms now, that's why we're doing this today, giving you real stats on our vaccination levels, what's going on with our patients, because as you know, the misinformation campaigns are powerful out there, and it puts us in a tough spot to convince our friends and neighbors and whoever to listen to the right sources. Okay, Governor Ricketts said the CDC announcement yesterday furthers the distrust people have with them. What do you think about the CDC rolling back or revising guidance throughout the course of the pandemic that has made people less inclined to follow that guidance? Well, that's why I opened with that statement, Brent. We do not have the same mistrust in the CDC. Again, accreditation is aligned with that. It's what physicians and healthcare providers have relied on for decades for a myriad of reasons. As far as changing course through the course of the pandemic, I am going to ask Dr. Trapp to come up, but we have learned from every step along the way, and it sometimes changes a course as we learn. So can you address that aspect of why we may have changed things throughout?
Yeah, has there been any surprise where there's been changes in this pandemic? I mean, what we say last week may not apply this next week. Really the CDC, I believe, is really working to do what's best for the population as a whole. We know some recommendations may not apply to all populations of patients. In other words, very rural populations, there certainly may be lower risk for widespread dissemination of this virus versus more populated areas. These are very difficult things to recommend. We know this impacts school-age children. We know this impacts finance and economics for the states and for private businesses and for the country as a whole. So these are challenging decisions to make. But the CDC is a group of very bright people that are well informed with regard to the risks of this virus, and they also try to reach a consensus. It takes time to do that, and we cautiously try to reverse our policy. But fortunately, they do. When they see changes that need to be made, they are making those recommendations, and we continue to try to follow those on a national level.
Now, I'll let you guys dig into the CDC's full statement, but this latest change, of course, is due to the transmissibility that appears to be present even amongst vaccinated people. Although it's preventing serious sickness and illness, it's found that we could perhaps spread it a little bit. So that's what, if you dig beyond the initial statement, is some of the rationale for it. Should elected officials be considering a mask mandate again? Should vaccinated individuals be wearing masks in groups? Well, I'm not going to comment on what elected officials should or should not be considering. What we're sharing with you is the perspective of a health system. Again, based on CDC guidance, even as mask requirements were released, to the public, they were maintained here at the hospital. So we have been masking inside and in essentially most situations here internally, unless you're in private offices or small meetings with available spacing amongst fully vaccinated folks. So that's really for the public to decide on what the role of politicians are in this. What we're sharing is what is happening in one of Nebraska's largest health systems that, during the course of the pandemic, treated as many as any hospital in the state of Nebraska. And as you look at the numbers today, we are again. As for should vaccinated individuals be wearing masks in groups, I think the CDC's guidance yesterday was clear on that. It's going to be an own personal decision. Do either of you two have anything to add to that? No. Okay. How difficult was it to reopen the COVID-19 unit? John, I think that'd be appropriate for you.
So you can imagine both mentally and physically to do that again. Our staff we're going to go through another iteration of this. And we were working in more of a decentralized approach as we were handling COVID patients as they came to our facility. Now, as the numbers start to reach the levels that they are, they're going, here we go again. And just look at what's happening in other communities. And they're going, if we're already at, 25 to 30 patients, it won't be long that we're going to be in the hundreds again unless people take action. I don't know if people have been paying attention to the Springfield, Missouri area. That CEO there has been pretty transparent about putting numbers out. And he said within a 45-day period, he went from about 25 patients to 147 COVID patients in his hospital. The staff, if you really think about that, dealing with the younger population and watching this disease approach them and attack them. As a healthcare provider, you're in a PAPR most of the day. You're taking protective equipment off and on. You're trying to be the intermediary between that patient and family members, trying to give as much information as you can. You become so attached and so connected to that patient, and we're seeing that these outcomes aren't good. So yeah, it's very, very difficult to open up a unit again.
All right, it looks like, is there going to be a vaccination mandate for Bryan employees and/or medical staff working there? This question was asked directly from a reporter earlier this week, and the statement we provided was, it's to be determined. Dr. Trapp has been on the phone with colleagues throughout the state, and what we said in that previous statement is, we're evaluating the situation, but until the FDA lifts emergency use, there will be no decision or announcement until then. Do you want to share anything there? Okay.
Thanks, Bob. Certainly, this is a high media topic right now. We've seen a number of organizations announce support of vaccine mandates for healthcare personnel. We've seen that with the American Medical Association, the American Hospital Association. I saw a report from my own organization, the American Thoracic Society. And we've also seen that with a number of other large hospital entities. I believe VA medical centers have made this mandate, and I was told today Mayo Clinic also made that announcement yesterday. So certainly this is an important decision. It's certainly something we are continuing to gather information and what that might look like. We have not made a final decision. We are in discussion with other healthcare entities, helping to understand how we can be consistent in our message. We know vaccines are important for healthcare personnel. We have strongly recommended, advised all providers and healthcare people to be vaccinated. We will continue to make those recommendations. At this time, we have not pushed forward a mandate until we better understand everything we can about this vaccine and transition from an emergency use authorization to an FDA-approved vaccination and determine what potential exceptions there may be to a vaccine mandate.
And just to summarize, I don't think we'll be commenting on this again until that FDA lifts the emergency use authorization, which is coming soon, though. The first Bryan employees got their shot in December. Are there any concerns that those shots will wear off? Do you anticipate booster shots becoming a reality in the near future? As of this time, there has been no call for booster shots. Dr. Trapp? No. Not foreseen at this point, but obviously that's something our friends at the CDC are monitoring closely. All right, it looks like they're wrapping up. Thank you for your time, and I just want to say again, thank you from the bottom of our hearts for getting out reliable and truthful information to the public. I shudder to think what situation we would be in if the misinformation would have overrun what our local media here in Nebraska has been able to counteract and balance and inform people. John referenced Springfield, Illinois, or Missouri. We're not them. because of the wonderful vaccination rates in this part of the state where we have population density. So we can't do this without all of you. So thank you. Please stay cool out there today and hydrate if your beats take you out to hot locations. Thanks. Bye-bye.